Hi guys, good morning. Now we're live. I was talking without being live. Okay, welcome guys to another episode of AMA with Dr. Ben. Thank you so much for joining us. Today, basically the topic of the day is that are there any benefits of combining both the oral and topical medication? Um, are there any benefits of combining the oral and topical medication? And the answer is yes, there are. So let's say if you're using basic oral finasteride for 6 months or a year, and you're not seeing the results that you want, you could actually add topical happy head, the topical finasteride, and by doing both oral and topical, it actually will give you better results. Also, the thing is true. Let's say you already started topical finasteride and you want to see a little better results, you could add the oral finasteride to the regimen, and that's going to basically boost your results. So, and then we see that quite a bit in our clinic, and it actually does work really well. As long as you're not having any side effects from the topical and oral, you could definitely add one or the other to the protocol. Okay, let's start with our questions. I was drawn to your product due to the ability to reduce finasteride side effects due to the topical application of the product. Do you ever recommend starting with a smaller than normal dose to start for the first few weeks to ensure no side effects? Yes, actually we do. So in our handouts, actually it says that you could start the first week doing the application once a day and then going to twice a day. But another thing you could do, you could just start as slow as you want. You could just do one application once a week. That means like do it on a Monday. The following week do it Monday and Wednesday. The third week do it Monday, Wednesday, Friday. So you're basically touching up basically by one day every week until basically you're doing the product every day. And also the product is intended to be done twice a day, but you could start with just doing it once a day. So you could do once a day, only one time in week one. Week two, you could do it once a day, only two, basically Mondays, Wednesdays, twice a week, and basically and so forth. So again, you could touch it up slowly, and yes, that is true. You will reduce the side effects. How can I reduce the itching on my scalp while applying Happy Head? Can you also alter my prescription, please, to reflect your recommendation? So, how to reduce the itch? So the itch mainly comes from the fact that the medication has minoxidil, and that could be a little irritating, and also is in an alcohol base. So a couple of things. One, you could wash out the product immediately after 1 hour. You're still gonna get very good efficacy, but it's just less irritating. But although I was talking to a patient this morning, and he said that within 5 minutes he was getting irritated. So you can also use a leave-in conditioner in the shower. That's another option. Or we do have an aqua-based formula that is basically the same ingredients in kind of like a water base. It's less alcohol in it. So you could let us know and we could switch it out. Just email us at help@happyit, and we'll be more than happy to do that for you. How often should a dermal roller be replaced? Good question. Typically about once a month, I would say. I mean, on a daily basis, you could basically spray with alcohol, but typically about once a month.
And then it can be sanitized, correct?
Yes, it can be sanitized. Just use it with alcohol. So the first time you use it, basically, just get alcohol spray it down, and basically apply it. And then basically, after you're done, just spray it again, clean it, wash it. Remember, don't be too aggressive. Don't make yourself bleed. The whole idea of a dermal roller is that basically it's going to allow the product to penetrate deeper. So you apply the product on your scalp and you gently roll.
How do,
Gen-
great. How do people know about like when to add extra medication? So the whole topic today is what are the benefits of combining the oral and topical? When would you or you be adding it when you
The-
start seeing plateauing results?
Yeah, no, so not really. So yeah, I mean, there are a couple different ways of doing it, and every individual is different. But that's Evelyn, by the way, everyone who helps us do all the Q&As. So let's say you're doing the product for 3 months, and you just want to start seeing faster results. You could start adding the oral finasteride to regimen at that 3 month interval, a 3 month duration. Given the fact that you already started on the topical, your body has already gone and used the finasteride, so the risk of side effects is typically lower. But let's say you're using the Happy Head for 6 months and 9 months and you're not seeing the results, then you could add oral finasteride. Or vice versa. We have a lot of patients that have been on oral finasteride for 5, 10, 15 years and they've plateaued. So, and that in those instances is a great time to add the topical finasteride and they will do really well. Is there a good way to dermal roll without pulling any of the hairs for thicker and longer hairing? Yes, the key is part the hair and gently roll back and forth. If you have very long hair, there's also something called a derma stamp. Basically, instead of you rolling it, you stamp it. We don't have that yet at Happy Head. We're looking into it, but basically it goes up and down, so it's less likely to pull out your hair. So that's a great option for um,
A derma stamp?
a derma stamp. Yeah, you could buy on Amazon. It's like 17, like $15. It's pretty cheap
And
actually.
is that the same? You would replace it as often as derma
Yeah,
roll?
it's the same, pretty much the same thing. Yes. So So, with respect to oral finasteride, one of the benefits that oral finasteride has is obviously something that's easier to do, but a lot of patients don't want to do it just because of the risks of side effects. So, one of the ways that we actually ease patients into it is by having them use a topical happy hit because that already has topical finasteride, and then basically about 3 to 6 months you could add the oral finasteride. And we carry both products, so you can always email us at help at happy hit, and we'll be more than happy basically to set you up with the oral finasteride if you really need it. Also, there are some patients that don't want to do oral finasteride because of the risk of sexual side effects. So there's also oral minoxidil. Minoxidil is also known as Rogaine topically, but there's an oral version of it as well. The benefit of it is that it has no risk of sexual side effects, and you could be on both topical minoxidil and oral minoxidil at the same time. Again, everyone's different. I think if you want to do it, send a question in. We'll help you. We'll guide you guys with the correct, with what to do, and we're gonna have our doctors prescribe for you. What other oral treatments can be added besides oral finasteride? So there's oral minoxidil. Oral minoxidil blood pressure medication they use off-label for hair loss in both males and females. Most common side effect of oral minoxidil is very similar to topical Rogaine, which is headaches, heart palpitations. Some people could get some ankle swelling, which is rare. There's also oral Dutasteride. Dutasteride is different from finasteride because it inhibits two enzymes as opposed to one. In some patients, it tends to work better, and sometimes we may combine oral Dutasteride with topical finasteride. So again, everyone's different. Everyone's unique. So if you have a question about your individual cases, please feel free to reach out to us, and we will have one of our doctors basically reach out and formulate the right treatment plan for you. Are there side effects from oral? Or are the side effects different from oral and topical minoxidil? No, they're typically the same, but patients sometimes may experience a little more of a side effect with the oral. The only thing that happens a little more common with oral is the ankle swelling that you rarely see from topical minoxidil, although we have seen it even with topical, but it's rare on the topical version.
What happens if someone experiences swelling from just the topical?
Yeah, so a couple things we could do. We could lower the minoxidil concentration, see if that makes it go away, or take the minoxidil out of the solution.
Okay, and then how long would you stop treatment to let the side effects subdue?
Typically, about a week or two, the side effects will go away. And another side effect of topical minoxidil, which we don't see often, but we sometimes see it, is swelling and darkening underneath the eyes. It has to do a lot with the fact is that this idea of swelling that could happen with minoxidil. We do see that with topical minoxidil.
It's like water retention?
It's called water retention, yes.
Mm. Okay, so for people with hair transplants, what would be their best bet to keep their results, and how can Happy Head help with that?
Yeah, so great question. So we do a lot of hair transplants in our office, and pretty much a lot of our patients go on happy at 6 weeks after hair transplant. It does two things. One, allows the transplanted hair to grow out faster, and two, it maintains the other hairs, so we prevent it from falling out. So you don't have to do another transplant in a year or two to kind of keep up with the falling hair.
Would you expect to see some shedding of the transplant results?
Typically not, but again, shedding could always occur with any topical solution, with any topical minoxidil solution. If the shedding does happen, usually patients tend to get much better results. Then somebody asks, if I achieve my goal of hair growth, will I lose my hair if I minimize or stop using the topical medication? Yes, you will lose your hair if you stop uh, using it. Sometimes patients minimize the use. So instead of doing it twice a day, they go down to once a day. Or instead of using it every day, they go to like every other day. And usually that does still maintain the result. But if you go down to like once a day once a week use, you will probably lose the results. Um, and can Happy Head help maintain results after hair transplant? Yes, it could give you better results actually after hair transplants.
Okay. Okay, and then how many more minutes?
Have you answered? Also, as far as hair shedding goes, where we had left off last week, for someone who sheds more on some days than others, uh, should that still not affect the result of the treatment? Hopefully, after as far as getting more hair goes overall. Yes. So look, hair is cyclical, and people are gonna go through different hair shedding days or hair shedding weeks or months. The results really shouldn't matter with the topical. The topical is still gonna stimulate basically hair growth. So regardless of your hair shedding, you should still use the topical.
Can you explain how finasteride, minoxidil, all these treatments work with the hair growth cycle?
Yes, that's a great question. So finasteride is a testosterone blocker, which means it blocks testosterone from converting to DHT, and DHT is responsible for miniaturization of the hair follicles. Minoxidil is a vasodilator, which means it increases blood flow to the scalp, causing more hair growth. And there are many different reasons why people typically lose their hair. So you could have the testosterone, and you could have, which is basically the THT, and you could have the lack of blood flow. And lack of blood flow, actually, studies have shown that it reduces the oxygen level in your scalp, and that inversely causes more DHT production. So in order to achieve kind of like to hit multiple different angles simultaneously, we usually combine the finasteride with minoxidil so patients get better results. So that's why the two ingredients are in Happy Head. So we're just targeting different reasons of why people lose their hair.
Okay, so with that in mind, the kitchen sink formula.
Yes, great. So the kitchen sink is finasteride and dutasteride with minoxidil together. Finasteride inhibits one enzyme for DHT conversion, and dutasteride inhibits two enzymes for DHT conversion. That being said, there are some patients that, for some reason or another, do better when they use finasteride and dutasteride. And if you read the literature, if you talk to a lot of patients out there or some blogs, you will see that there are some patients that will use oral finasteride 5 days a week and oral dutasteride 2 days a week, or they use oral dutasteride with topical finasteride. So remember, guys, there's no simple way, and not everyone's the same. Everyone's gonna respond differently to it, and some people come with different methods, which is fine. So, and this is why we have the kitchen sink formulas for those people that want to have the finasteride and dutasteride together. And patients do say basically that it does benefit them quite a bit, and they do like it. But again, is it for everyone? Not necessarily. I do recommend that people should start with the topical finasteride first and see how they do before we go on to topical dutasteride or add other oral medications like oral finasteride or oral minoxidil or oral dutasteride to the regimen.
Okay, so there's like a hierarchy to it.
Yes, there is a hierarchy. There is science behind this madness, but and everyone's different. This is why you have doctors writing these prescriptions. So everyone's different. It all depends on how you're responding. Look, if you're doing topical finasteride and your response is great and adequate, then you don't need to do anything else. So, and this is where most people start, and basically from there, basically things change. So, and again, if you see you're doing it and you're not seeing the results, reach out to us, and we're going to come up with an additional game plan for you guys. This is what we're here for. And again, with respect to so the topical Happy Head, a lot of people have this question with respect to a dermal roller. You should apply topical Happy Head first and then dermal roll. I think that basically allows the product to be penetrated deeper, and you will get better results. Another question we had from someone else this morning was that can I just use the Happy Head in the crown area, because he had read that Rogaine could only be used in the crown. With Happy Head, you can use it everywhere, front and crown. You can use it all over the scalp, and it's typically 2 pumps twice a day. Patients take about 4 to 6 months to see results.
If I only wanted to grow a certain part of my scalp, would putting very small amounts in that area daily, would that work?
Yes, I mean, look, some people only have widow's peak issues, so basically they only apply Happy in the widow's peak areas. So you really want to put it really where you need it. So I mean, look, if you diffuse the thing everywhere, then you want to put it everywhere. If you're just thinning in the crown area, then you want to put it in the crown area. If you're thinning only in the widow's peak, you mainly want to put it in the widow's peak area.
Okay, and then how would you go about to know how much to put?
Well, so how much? The great question. So usually 1 pump per area. So if you put in the widow's peak, 1 pump on the left, 1 pump on the right. Remember, don't put it directly onto onto the forehead. Go back 2 to 3 inches behind. Pour the product there and basically rub it forward.
Okay, that's a good answer.
Because we do have sometimes patients basically it gets onto the face. It's not a problem for guys, but sometimes for females it is. So I would just keep it away from the face. Also, if you're female, we typically recommend doing the 6% minoxidil, not the 8%, because again it could cause peach fuzz, especially if you're more like of darker Middle Eastern or Hispanic descent. You're gonna notice more of a dark hair on your face.
Oh, okay. So for women to avoid peach fuzz, how would they go about
So basically keep it away from the face. So what you want to do basically, if you want to put it in the front of hairline, don't put it directly in the front of hairline. Go about 2 to 3 inches behind the hairline. Drop the product back there and push it in, massage it in with your hands, and then just wash your hands afterwards. So I still believe my overall shedding has decreased a bit after 2 months marking to it, but short of find it a little concerning when I have to notice some more hairs on my fingers upon washing and using treatments certain days. Yeah, so basically our patient here is concerned that he is doing better, but he's still shedding some. Look, first of one, you're still using it only for 2 months. Typically, happy head, you're gonna see your best results around 5 to 6 months. Number two, it doesn't necessarily mean that you're gonna stop shedding. I mean, look, you could have more hair growth and still shed. We see this every day. In fact, yesterday in my office, one of our celebrity patients came in and he was shooting a film in New Mexico. And he's like, Doc, I'm losing a lot of hair. Look, I'm like, that's true. But we compared his photos to a photo from a year and a half ago, and he's certainly better. So it doesn't mean that if you continue to shed hair, that you're not responding to happy end. This is why taking photos is actually very important. And in our office, we always take photos to track patient progress, and we highly recommend you guys do that at home as well. Take photos of the front and of the crown. And honestly, best thing is to actually have someone else take those photos. It's a much superior photos. Honestly, don't try to take it yourself. It's always at a different angle in a dark bathroom. It just doesn't look very good.
Yeah.
We see a lot of those photos, by the way. So
The best ones are if you're standing in front of the mirror, you can see the front, you can see the back.
yeah.
Okay,
Again, if you have someone else take your photo, that's probably ideal.
if you're a woman and you're still seeing peach fuzz, it could probably be minoxidil.
On your face?
Yeah.
Yeah, so typically the peach fuzz on the face is minoxidil.
Okay, so what would you recommend women start at?
It-
Minoxidil concentration.
6% still.
6%.
Yes. And remember, there's also a third ingredient in the Happy Head product, which is the retinol, the tretinoin. And that makes the product basically penetrate deeper and gives patients better results.
Can you explain why you? Okay. So what convinced you of the importance of retinoic acid?
So why do you have retinoic acid in the product? Well, if you actually read the clinical studies, so in clinical studies, they tried minoxidil alone by itself, and then it was minoxidil with retinoic acid, and they realized that patients that did the minoxidil with retinoic acid only had to use the product once a day, as opposed to twice a day, which means once a day application was equivalent to regular minoxidil twice a day application, which means that adding the retinoic acid makes the minoxidil penetrate almost twice as good. Now, Happy is still supposed to be used twice a day because of the finasteride ingredient in there.
It's twice a day because of the finasteride?
Finasteride, I mean, patients see definitely better results when they do it twice a day, morning and night. Again, it doesn't have to be like 12 hours apart. Just do it in the morning and do it again at night. Do that. In those instances, patients see the best results.
Would the retinoic acid do the same with just finasteride? Say a patient just wanted topical finasteride, no minoxidil. Would you choose to still keep it?
Yeah, so it depends. The study was done only with minoxidil, not with finasteride, but we still do believe that having the retinoic acid with finasteride does still allow the finasteride molecule to penetrate deeper. The only time we would probably take it out if it's just irritating. So if someone complains of too much irritation or itchiness, then we would take out the minoxidil. I mean the retinoic acid. I'm sorry.
Why hydrochloride?
Why hydrochloride? That's a great question. So So the product could sometimes be irritating. The minoxidil is irritating. The alcohol base is irritating. So we add aloe to it along with some hydrocortisone to reduce some of the irritation. Again, it's a very low dose amount of hydrocortisone. It's just hydrocortisone 1%. Again, if patients feel uncomfortable, we could definitely make a new batch for them without the hydrocortisone.
Okay. A lot of our customers have issues with propylene glycol.
Yes. So if you have an issue with propylene glycol, we do have an aqua version of it where there is no propylene glycol. Please reach out to us at Help and Happy Ed, and we'll be more than happy to set you up on that plan.
Keep in mind that right now we have very few concentration, few
Yes.
customizations.
Yeah, customer. Yes. So on that aqua's formula, there's really no customization. There's only one product you get. Um, you basically just get one product. It's this finasteride 0.25% with retinoic acid, um, minoxidil 8%, and hydrocortisone. So that one is not customizable.
So we have our current standard formula, which we think is the strongest, and that's what we're testing right now, and then they'll be available. So, how would oral versus topical affect DHT levels?
Yeah, so that's a very good question. So if you look at the studies, the topical finasteride 0.25% done twice a day gave you the same, in fact, similar DHT changes in both the scalp and the body. So the change in DHT is the same. So the question then becomes, why is it that oral has more risk of sexual side effects than topical? The answer is one thing, nobody really knows. But the second thing is that the oral finasteride will also affect your overall testosterone level, whereas topical finasteride does not change your testosterone level. So it might affect the DHT, but not the testosterone level. And that's one of the theories. That's why there's a difference between topical and oral finasteride with respect to sexual side effects.
Okay, and is there a difference also in absorption in how it goes to the body versus the scalp? Like that's the thing. Like I've heard like certain amount of concentration when it's taken orally is
Yeah,
digested.
yeah, that's true. Yeah, so when you take oral, basically, it literally has to go through your entire body, liver, kidney before it gets to a scalp. But whereas when you apply topically, literally 80% of the product stays right there. So this is why in clinical studies the topical was as effective as the oral finasteride, and that's why basically Happy is a great product because you have the topical finasteride, which is as good as oral finasteride with low risk of side effects potentially according to clinical studies, and we've also added prescription grade minoxidil, prescription grade retinoic acid. You have three prescription grade ingredients all in one, whereas when you only do the oral, basically you only take one product and not three. Again, please remember, guys, Happy is a customizable product, which means that we customize the product just for you. So if there's any issues when you have the prescription medications and prescription ingredients, we'll be more than happy to change the ingredient, lower it, or remove it completely for you. You just have to reach out to us at Health and Happy, and we'll be more than happy to do it. I think we are the only customizable topical finasteride formula in the U.S. market. Other companies make a huge batch, and basically you can't really change it. With us, literally the product is made for you guys on a monthly basis, and we ship it out. So this is why we're able to customize it, and we do believe that everyone is unique and everyone's different. And everyone has a different hair journey, and we're here basically to help you with that journey as we go along.
Okay, how would people know that it's time to increase their concentration? Aside from the plateau and results, we have a lot of customers that have been with us for a year and they've been with that formula, but it's hard to tell like when do I need to go up.
Well, here it depends. So right now the finasteride 0.25%, that is the highest concentration you could get, and that's the one that everyone starts out on. So if you're already on the finasteride 0.25, there's really not much to go up. If you're on the lower dose, like a 0.1, so then we could certainly go up higher on it. It all depends on how your hair is doing. So, and that really depends on how you feel your hair loss is doing. And then if you don't think it's doing as good, please reach out to us, and then we could accommodate the increase of finasteride concentration for you.
If you the 0.25 is the highest we have, would you recommend oral versus or minoxidil? Like which
Yeah,
ones do you think
so
are
that's a
better?
very good question. So if you're already on the topical happy head with the finasteride 0.25, and after let's say a year you have plateaued, what to do next? Should you go on oral finasteride or should you go on oral like minoxidil? Everyone's different. It's really a question about knowing all the side effects. Some patients do not want to take any oral pill that may increase risk of sexual side effects, so that's why they might not do the oral finasteride, and they might choose instead oral minoxidil. Some other patients are on other blood pressure medications, so they don't want to go on oral minoxidil because that could drop the blood pressures more. So then in those cases, they will choose the oral finasteride. So everyone's different and every small situation is different. It really depends basically on your own past medical history. So if you are in that situation where you want to add an oral medication, reach out to us and we'll be able to figure it out for you.
So it's a mix of trying to mitigate the side effects.
Yes, the key is to mitigate the side effects, depends on past medical history, what medication you're taking, and what you're really concerned about. Really, that's the key.
If somebody still wants the strong formula, what would be a way to mitigate that?
The side effects, yeah, so basically it's to try to touch it up slowly. So if you want to go with the finasteride 0.25 and you want to mitigate the side effects from topical medication, so the key is just start touch it slowly. So do it once a week and then do it twice a week and do it 3 times a week, so every week you're going up by one more day, and that will reduce some of the side effects. And then, guys, remember, it takes about 6 months to start seeing results. I mean, we do have a lot of patients that after a month or 2 or 3, basically, they come and say, "Oh, wow, this is great. I'm already seeing results." But typically, it takes about that 4 to 6 months. So the key is to be patient, and it's not a race. Remember, it is not a race. So the key is to actually touch it up slowly, so you don't end up with sexual side effects.
So we can connect them with a doctor to help them along their journey.
Yes. Our doctors are always available, so and we don't charge for additional doctor visits. Please let us know, and we'll be more than happy. You could get in call with me, or basically with the doctor that wrote the prescription for you, or send us an email. Again, we have a lot of patients. They don't know if you're a good candidate or not for happy yet. Take a photo and send it in, and basically we're gonna let you know.
Let's see. I don't think we have any other questions on here.
All right, guys. Well, thank you so much for coming to another Q&A with Dr. Ben. Thank you, Evelyn, who's the one who basically asked all the questions, and Eric, who is in the background, basically helping make things go smoothly. Smoothly. A lot of effort goes into all these sessions. All right, guys. We're gonna see you again next week for another AMA. Have a great August, and we'll see you guys next in a week. Have a